Hello, everybody. Ryan McMahon here. Go over some COVID data. We talked yesterday at our briefing that today was going to be a tough day, so let's talk about it. We'll get the good news out of the way. Nobody passed away over the last 24 hours. That's positive. Uh, but related to cases, we have 99 cases, the highest we've had since the pandemic began. Not the highest rate of positivity or infection, but the highest case number. Uh, when we have this many cases, it's very hard to quickly contact trace and quarantine because it's just a lot of work. And so the reality is this does pressure our medical infrastructure. You've heard me talk about uh, in this process, everybody's heard flatten the curve. We flatten the curve. We crush the curve. Preserve your medical and hospital infrastructure. We're starting to see upticks in that. There's always been a direct correlation with case numbers and hospitalizations. And for us, that's something that we have to re-engage on. So let's go over what the data looks like. What's it telling us? Out of the 99 cases, 21 were related to higher ed, so about 20%. You did hear about two clusters up at Syracuse University, two parties that have led to what are probably 30 cases right now total. So these clusters have not gotten out of control. We only have 13 of those cases in our data today, so tomorrow we'll have the other 17. But it does, I spoke to the Vice Chancellor, it does look like right now things look like everybody who was at those parties was tested, and now the quarantines have been put in place. So that's positive. Out of the 21, out of the 99 in higher ed, 5 of these were people that were transferred into the community. They got sick outside the community. They're now getting better in the community, so they become our cases. Looking at probably the only good news related to cases today, are 5 out of the 99 are related to school, K through 12. Again, we've been saying this all week. The data shows that school is not the problem in the community right now, not even close. So that's the data continues to show that. Another piece of good news for the day, there were no senior facility cases, direct correlation with loss of life in these cases, so that is positive. A concerning number overall, we have 68 community spread. That's 68 cases of community spread. We know 32 of the source. That should concern everybody that we only know 32 out of 68 right now, considering how 13 of those 32 we know came from SU. So when you think of it that way, there's a lot of spread going on in the community. And I'm going to go over why. I'm going to go over the examples. I'm going to be very blunt with everybody. Household contacts 13. These are folks who are already in a quarantine. They become sick. We know this happens essentially out of a case. Out of 100 cases, 10 to 15 of these usually become positive with members of the household because of the distancing and of isolation inside of an actual residence. So that number held true there. And so 3 of these cases still being traced and 1 being a group home facility. So out of the travel cases, right now our initial investigation shows that these cases came from the states of New Jersey, Pennsylvania, Virginia, Michigan, South Dakota, North Carolina, Arizona, Kentucky, Florida, and 5 in other parts of New York State. Our investigations show that nobody quarantined, 0. So nobody followed the state guidance. In addition to that, these folks got tested when they were sick. So here's the deal. We know that there's all these travel sports going on. We know people are traveling. It's part of life. Testing needs to be part of this. Do your community a favor, and if you're going to travel, when you come home, you get a test, period. There's no excuses not to. Think about it. Some of these cases got home 5-6 days, they had COVID, and they're living their lives in the community. We wonder why we don't know the source of community spread. These are the types of things that we can't do, and we know better. We've been through this in the pandemic. We've been doing this a long time. So certainly, if you're traveling, my request is when you get back, you are supposed to most likely be quarantining. If you're an essential business, you don't have to, but you need to watch your symptoms. But in addition to that, I need you to get a test. You have to get tested if you're traveling when you come back, regardless. So please do that. Clusters. Let me just give you some examples of the last week. Weddings. We probably have a wedding that was not more than 50 people, but very close to everybody's going to have COVID. Okay? That's what happens when somebody's sick, goes to a wedding. And so when you're sick, you can't go to these events. As much as you want to, you need to get a test. You need to rule out COVID. Birthday parties. I know these happen. They're going to happen. People, please be cognizant. Again, if you're sick, you can't go or you can't bring your child to a party. We have seen multiple birthday parties. Obviously, clusters at work. We've been talking about this happens. Folks are going to work sick. Then all of a sudden, your business has 7, 8, 9 people out, and they're struggling to find people to continue to keep the operation going. Golf tournaments and travel sports. Many of our travel-related cases are related to travel sports. Again, if you're going to do it, you're going to do it, but you're supposed to be quarantining, and you need to get a test. Restaurants, bars. What we're seeing is we all know this is where people gather. Large gatherings are where we are seeing the virus spread very intensely, and we have multiple clusters. So related to enforcement, the data tells the story. We have enforcement units going out this weekend. The goal here is not to hurt a business or hurt anybody. The goal here is to make sure that the guidelines that have been set forward by the state of New York's health department are being followed by the business owner. All these businesses know what the guidelines are. They know what the rules are. They've followed them throughout the pandemic. Whether or not they're following them still, data would suggest that in some cases they are not. But maybe the data is wrong. Maybe the virus is just that infectious right now. So we will be having units going out Friday and Saturday for gatherings, for following the data related to businesses that have been impacted, where the data would suggest that the rules may not be being followed. And in addition to that, we've received numerous complaints about large party gatherings this weekend. We will be following up on those complaints as well. We encourage everybody for Halloween to enjoy yourself, but enjoy yourself with small groups, not these large groups. It's here. It's in every town in our county, every part of our city. The virus is here. We need to start to starve this virus again. To give everybody a global perspective on the state of New York, communities that hit a certain level with a positive rate, they go into what is called a pause zone, where it's a yellow light, an orange light, or a red light. What this is essentially your data hits a certain point where the virus is at 2%, 2.5%. The state then puts in restrictions on businesses and gatherings in those areas. So essentially, we're going backwards on restart going into those spots. These are essentially not written in stone, but if we look at where they've gone into in other parts of the state, you're looking at 2%, 2.5%, 3% rates. We cannot test 10,000 people a day right now. So if our community wants, if we're in a position where we have 100 cases a day, we will quickly get to that plateau over a 14-day period of time. So everybody needs to wake up right now. The COVID fatigue, I get it. We've all had it. I've been guilty of it as well. We all need to modify our behavior now. We all need to be smart. If we're going to be with each other, we do need to distance. We do need to wear masks where we can, so that we can quickly turn this around, so that we're getting into what a new normal is. And a new normal is not going to be 10 cases or 20 cases anymore. We're indoors now more. The virus will spread. That's part of us having to deal with it. But 30 cases, 40 cases, 50 cases, this is something that we're busy doing what we need to do to fight this virus, but we'll be able to get by. But it is not possible for us to do 10,000 tests a day for 100 cases a day to keep our data where it is. And what will happen too is eventually there will be so many sick people that our hospital rates will go up. And that's something that, again, we can't have. Speaking of that, I don't think I gave the hospital numbers yet. A little bit better than yesterday, but again, we've had close to 170 cases over the last 48 hours. So I think that these numbers are in jeopardy, potentially. Knock on wood. I hope not. 24 hospitalizations. That's down 2. And we have 4 of our neighbors in the ICU, so please think of them. And so, you know, that is what it is. We're going to have to watch that closely. We've been talking to Upstate and the other hospitals, and everybody's changing different rules of their operation to help make sure that our sick and our vulnerable are not going to be impacted by this uptick in COVID cases. Saying all this, tomorrow we're going to have a busy day again. I think with the virus, what we've learned is that it takes 2 to 3 weeks of solid modifications of behavior. The way we can do that is we can enforce to make sure that the businesses that have seen cases are doing the right things, and hopefully that helps. But it's really up to all of us in our own lives, with our own families, to reassess our activities, do things in a safe way, make sure that we're distancing when we're with people. And so if we can do this now, maybe we've started to turn the page already because we've been messaging this for a period of time, but we'll find out. 2 weeks it will take us to get this data back to a better place in a sustainable way. So that's our ask. Please work with us. We'll continue to beef up testing, make it more available faster for people, but we need people to work with us now too. We can't have you be fatigued. There's too much on the line. Thank you, and please have a safe